dear students, welcome back to Odelia Vlogs. Today we can study healthcare management on an exam point of view. I will give you important questions module wise. First from module 1. First of all, you will have a question: what is a hospital? What is the role of hospital in provision of various health services? A hospital is an institution providing medical and surgical treatment and nursing care for sick or injured people. Role of hospitals in provision of various health services include not only curative but also preventive measures. There are different types of hospitals you have to study: private hospital, public hospital or government hospital, specialization hospital, nursing homes, diabetic clinic, general hospital, corporate hospital. That is example Apollo Hospital, homeopathy, Ayurveda, Unani, Siddha. Study all this. Once you study types of hospital, there will be an essay question and also you can answer 2 marks and 5 marks questions. Next is role of hospitals in development of society. Hospitals provide individuals, families and communities with promotive, protective, preventive, diagnostic, curative and rehabilitative measures and services. When you get a question as essay question, this role of hospitals in development of society, you can also add regarding primary healthcare center. Primary healthcare refers to the essential healthcare made accessible to individuals in a community at cost they can afford. The World Health Organization put forward the concept of PHC that focuses more on the importance of community participation by identifying some of the social, economic and environmental determinants. PHC includes basic services required to meet one's everyday healthcare needs, like conducting a regular health checkup with family doctor or visiting low-income health clinics. We can study the elements of PHC. This is important. Once you have an essay question, you can write this always regarding hospitals service in health and in development of society. So the elements of PHC: first one, promotion of food supply and proper nutrition. Second one, an adequate supply of safe water and basic sanitation. Third one, maternal and child health care. Fourth is education concerning prevailing health problems and the methods of preventing and controlling them. Immunization against major infectious diseases. For example, when COVID-19 came, all the health providers came to our home and gave us information regarding the vaccines and all, and similarly about polio vaccine, etc. Prevention and control local endemic diseases, just like dengue fever. If there is in our locality, we will be informed and we should care our surroundings, etc. Then provision of essential drugs, appropriate treatment of common diseases. So this is the first module, important questions. Study this. Essay question is sure on types of hospitals or role of hospitals in provision of various health services or role of hospitals in development of society. In all these cases, you can write about PHC. Role of hospital in PHC. That is also asked sometimes. Hospitals have a great role in public health care. First one is curative health care, family planning, preventive health care, health promotion, education and training of health workers, physical rehabilitation, health education, administrative support, technological support, community care training. Role of hospital in various health services can be also included early diagnosis and treatment and rehabilitation. So these are all common. This is a general paper. Actually, this is a choice-based paper for you. There were 4 choices, and this healthcare management is chose because that is very easy and you can get good marks for this. Now we can study the important questions from module 2. First one is need for healthcare management. Healthcare management is the planning, administration and management of all healthcare systems hospitals, and other medical facilities. It's a growing field in need of qualified professionals with accounting, communications, policy making, computer software, and project management skills. Second question, that is a 15 marks question, budget allocation methods in hospitals. You have to write about budgeting and the steps involved in budgeting process. Next is principles of management. It's nothing else but Henry Fayol's 14 principles. You have studied this in first semester in principles and methodology of management. I gave you a mnemonic. I see you, Dad, use roses. I will explain that once again. I for initiative, C for centralization, U for unity of command, D for discipline, A for authority and responsibility, D for division of labor, U for unity of direction, S for stability of tenure, E for equity, R for remuneration, O for order, S for stability of tenure, E for esprit corps, again S for subordination of individual interest to general interest. And you have to explain these 14 points in detail. Next is staffing in hospitals. You have studied this in human resource management in your third semester. Staffing is a selection, training, motivating, and retaining of a personnel in the organization. Nurse staffing is a constant challenge for healthcare facilities. Before the selection of the employees, one has to make analysis of the particular job which is required in the organization, and then comes the selection of the personnel. Next is HRM in hospitals. HRM deals with the issues related to compensation, performance management, organization development, safety, wellness, benefits, employee motivation, and others. Human resource management plays a strategic role in managing people and the workplace culture and environment. The most important aspect of HRM in healthcare is ensuring that there are enough human resources to run an effective organization. Proper management of human resources is imperative in the recruitment and maintenance of clinical and non-clinical staff, promoting staff morale, then providing opportunities for specialized development, and in the capability of a healthcare organization to provide quality healthcare services and progress patient health outcomes. Next, what are the causes of poor human resource management? That is, HRM is considered poor when there is lack of order, motivation, ethics, and productivity within an organization. Both the long-term and short-term organizational goals are not met timely in a poorly managed organization. Next, what are the suggestions to make HRM activities more effective in hospitals? You have to improve organizational communication, develop an effective training program, build a company cultural vision, use available technology, and take advantage of data. Next, financial planning and policies influencing financial planning. Financial planning is a step-by-step approach to meet one's life goals. A financial plan acts as a guide as you go through life's journey. Essentially, it helps you be in control of your income, expenses, and investments such that you can manage your money and achieve your goals. Important questions from Module 3, first one. What are the problems associated with inpatient care and suggestions to overcome it? That's a 15 marks essay question. Study that very well. Inpatient care refers to the medical services that require a patient to be admitted by a doctor into hospital so that the patient stay overnight for medical observation. Next, problems associated with OPD and suggestions to overcome it. That is outpatient care. Outpatient care describes any medical procedure or treatment that does not require a patient to stay overnight. Next is functions of a nursing officer. Nursing officer is the first level professional nurse in the hospital who is directly answerable to the assistant nursing superintendent who is responsible for quality clinical care of the patients. The senior nursing officer is responsible for the total care of patients in the wards, supervision and guidance to nursing officers, student nurses, hospital attendants, sanitation attendants, and security staff. Next come administration of nursing unit. It consists of the performance of leadership functions of governance and decision making within organizations employing nurses. It includes all the management functions: planning, organizing, staffing, directing, controlling. Next, we can study the targets achieved by Indian government under various national health programs. First one is NPCCHH, that is National Program on Climate Change and Human Health. Second one, IDSP, Integrated Disease Surveillance Program. Third one, GWEP, that is Guinea Worm Eradication Program. Fourth one, AMR Containment, that is Antimicrobial Resistance Containment. Another one is YEP, that is Yaws Eradication Program. And the last one is National Viral Hepatitis Surveillance Program. Next is an easy question, that is a 15 marks question. You should study this very well. Compare and contrast private and government hospitals. What do you mean by a public hospital and a private hospital? Both of them are health service providers. Private hospitals are hospitals managed and funded by an individual or a group of people. These are equipped with modern healthcare equipments. There is short waiting periods for the patients, then personalized patient care. Public hospitals are hospitals fully managed and funded by the state. Personalized care may not be as efficient as compared to private hospitals due to low doctor to patient ratio. Also, long waiting periods is another problem here, but it is much affordable for the poor. That is, private hospitals are very expensive and it is affordable only for the affluent people, the rich people, but here in the case, poor people can easily go to a public hospital and get admitted, but they will have less care. That is the disadvantage. Next, we can go to the fourth module, important questions. Hospital services, which include clinical services, study that very well. X-ray department, you have to study that also. It will come as a 5 marks question. Then comes lab services. X-ray department also include what is radiology and all. You have to study that also. Then you have to study departments of a hospital. That is an essay question. Pediatric department regarding child, kids, etc. Then orthopedic. Then pathology, emergency department, obstetrics and gynecology, oncology regarding cancer, ENT department, neurology, cardiology, etc. Study all this, very, very important. Next, we can go to the important questions from module 5. Role of government and private players in promotion of health tourism in India. It is the responsibility of the government to prevent and treat illness, provide proper health facilities like healthcare centers, hospitals, laboratories for testing, ambulance services, blood bank, and so on for all people. These services should be within the reach of every patient of the remotest corners. Private sector provides health care for 80% of outpatients and 46% of inpatients. It has been playing a dominant role in medical education and training, medical technology and diagnostics, manufacture and sale of pharmaceuticals, hospital construction and provision of medical services. Next comes types of medical records maintained by a hospital. That is very, very important. There are different types. You have to study all that. Characteristics of medical records, functions of medical records. Then what is medical record committee? Mechanism of record management of hospitals. Next come necessity of maintaining proper medical records. To develop good medical records containing sufficient data written in the sequence of events to justify the diagnosis, treatment and end results of all patients treated in the hospital, keep them under safe custody and make them readily available as and when required. Actually, medical records are always useful because once a patient is dead in an hospital, sometimes might be a casual death or sometimes it might be due to error in operation or due to a mistake by a doctor, and in that case medical records will help for filing a case, etc. Next, we can study the legal aspects relating to medical records. Police authorities and court can summon medical records under the due process of law. Limitation period for filing a case paper is maximum up to 3 years under Limitation Act. According to the Consumer Protection Act, it is up to 2 years. Next, you have to study tourism as a part of healthcare management. What are the reasons of health tourism in India? Usually people come to Kerala for Ayurvedic treatment. Then advantages of health tourism you have to study. Disadvantages of health tourism. What are the functions of Medical Council of India? Then a new question, that is new avenues of healthcare management. It's not yet asked. Sometimes it might be asked as a 15 marks question. Just focus some or 2 points for at least 2 marks question. And this is the end of our all modules important questions. Study this very well. We don't have enough time to start from module 1, 2, 3, 4, 5 in detail. That's why I gave you important questions module wise. So study this very well. Thank you, students.